I am Dr. R. K. Rawal, a senior consultant physician and in practice for last 40 years. In today's session, we are going to talk about cholesterol, how we can manage the cholesterol in our body. Well, cholesterol is a essential component of our blood and the body tissues. Almost all the cells of the body need cholesterol for the making of hormones, vitamin D, and bile acid in our body. Bile acid is used for the absorption of fats. Now, this being the essential component, but there has to be a limit. Within limits, it is good, but when it goes out of a limit, then it becomes bad. Cholesterol is a fatty substance which circulates in blood, but blood being watery in nature, the cholesterol does not get dissolved in that. So it needs a carrier to circulate in our body. And that carrier is in the form of lipoproteins. There are two types of lipoproteins basically. One is LDL or low density lipoproteins which carry cholesterol. The inner core is that of the lipid and the outer core of this lipoprotein is that of protein. Now, this bad cholesterol, LDL is the bad cholesterol and it gets deposited in the inner wall of our arteries where it makes them hard and there is an obstruction to the blood flow. As a result, it causes hypertension and it can also cause a heart disease. Now, why it is called bad cholesterol? Bad cholesterol because it blocks the arteries and can cause us disease as dreadful as a heart disease. Now, other lipoproteins are high density lipoproteins, HDL. HDL is good cholesterol. The H in the HDL can be remembered as healthy, so it is good cholesterol. Now, the important function of HDL is to drive the bad cholesterol out of our body so that the arteries don't get blocked. This is the reason why we call it good cholesterol. Now, how to know whether we have cholesterol which is optimum for us? There are no signs or symptoms. There will be no alarm ringing for us that the cholesterol is high. The only one method of knowing is that we do a blood test, lipid profile on a blood test, which tells us about the cholesterol, the triglycerides, the HDL, that is a good cholesterol, about LDL, that is the bad cholesterol, and VLDL. Except HDL, all other are bad cholesterols. Now, what is the target? How much should be the cholesterol? The total cholesterol should not be more than 150. More than 150, we have to target it and bring it down. The triglycerides again, 150. The HDL should be, the good cholesterol should be more than 60. The LDL should be less than 100, but the latest recommendation is that it should be around 60 to 70, 70, 75, 75, 80. That should be the levels of LDL because LDL is the most notorious in causing obstructions to the blood vessels. And the other is VLDL. Now, this is about the levels of cholesterol. Now, when it is high, what is to be done? When it is high, what is most important is that we bring them down to comfortable levels, and the best way is managing our lifestyle. Lifestyle management is of top importance because this attributes to the bringing down of cholesterols in various ways. And in what way we can do that? How we can manage our life? By eating healthy food. Now, what is healthy food? Healthy food is low in saturated fatty acids. That is lean meat. If you are a non-vegetarian, you should take lean meat and avoid fatty meat. Fatty meat is that of goat or beef. These are fatty meats. So avoid that. You can take seafood. Fish is lean meat. Chickens are lean meat. And avoid taking milk that is creamy milk. So you should take, instead of creamy milk, you should take fat-free milk, very commonly known as toned milk or double toned milk. And then use plenty of fruits, vegetables, dairy products made out of cream-free milk. So this is about the food. Now, what comes next in lifestyle management is the exercise, activity. Sedentary life adds to your weight, and sedentary life is bad for your heart. So activity is very important. Activity in the form of brisk walk, bicycling, or some dance, or some aerobic exercises. All this exercise for about 150 hours in 1 week is, 150 minutes in 1 week is very important. And this should be on top priority because it helps in circulation and formation of small vessels which help in the circulation of heart. This is about the activity that one should be doing. Now, smoking is very dangerous in people who have a high cholesterol. So one should quit smoking because smoking helps in destruction of the good cholesterol, and it helps the bad cholesterol rise. So quitting of smoking is very important. Then comes the weight management. If you are out of your prescribed weight, then bringing down your weight by 10% of your present weight will help reduce the LDL and will help raise the good cholesterol. Then manage stress in your life. A stressful life can cause the sympathetic innervation get more active and cause a heart disease or precipitate a heart disease. So manage your stress by doing some meditation and go out and play, manage your stress. And then comfortable sleep for about 7 to 9 hours every day for everyone is essential. It can be in 2 parts, if not in 1. So this is about lifestyle management and comes on the topmost before medication. I will again emphasize that managing your lifestyle is more important. And if still we need to do more, then we have medicines to reduce your cholesterol. For that, the doctor has to do it. Common medicines are the statins used for hypercholesterolemia. Then we have nicotinic acid. We have fenofibrates for managing triglycerides. Then we have cholesterol absorption inhibitors, and with all these medicines, we can keep the cholesterols in level and help you lead a comfortable life. Now, this is about how we can manage the cholesterol, and remember that cholesterol management is very important, and especially the bad cholesterol should be taken care of, because bad will always cause bad things to you. So be very careful about your cholesterols. Keep a healthy life, active life. Don't smoke. That is my message to all of you, that don't smoke, because on the pack of cigarettes it is written that it kills. It is not written. It is not just written that it is unhealthy. It is injurious, but it is written that it kills, and it really kills. So be very careful. Don't smoke. Keep your weight well within prescribed limits, and enjoy a happy and healthy life. Thank you very much.